Okay, here's our video for chapter 12. So we're going to transition from we sampled individuals in the last chapter to now we're going to impose upon treatments or collect the data side of things as far as the process of choosing individuals and collecting data. So here's our first question as far as dealing with the word maggots. One experiment tested the ability of maggots to remove dead tissue from open wounds that would not heal on their own. Sterile maggots were placed in a small pouch, which in turn was placed on the wound. 100 men with wounds on their lower limbs were randomly assigned to receive either traditional surgical treatment or a maggot therapy. After 8 days, the percentage of dead tissue in the wounds that underwent maggot treatment was 54.5 compared to 66.5 for the surgical treatment. The difference decreased with time, and the advantage disappears after about day 15. Neither the patients nor the doctors evaluating the wounds knew which therapy had been applied. Patients were blindfolded, the bandages were changed. Surprisingly, the number of patients that reported a crawling sensation in their wounds was about the same in both groups. So, first of all, what kind of study was this? So again, we're choosing between, is this an experiment or an observational study? And this one is going to be an experiment. It is an experiment, and this is how we tell the difference between the two, because a treatment was imposed. We said up above that we either received a traditional surgery, okay, or we underwent maggot therapy. So there was two treatments there that were given. So that is why I randomly assigned them. So that is why this is an experiment. Is it appropriate? Is that an appropriate choice for this investigation? I'm going to say yes or true. I'm not for sure what Math Excel will want you to answer there. Who are my subjects? Again, vocabulary laden. The subjects are the individuals that receive my treatments. So these were 100 men with lower leg wounds. So again, the different parts of this, we have to know what a treatment is. We have to know what the response is. There are many treatments. The treatment was a wound care. It happened at many, which is also called a factor. Sorry, what's the backup of it? Factor is what we change. In this case, the factor was the wound treatment. This happened at two different levels. It happened at maggot therapy and a traditional. So my treatments are related to my levels, and therefore it's going to be two treatments. It was the traditional and maggot therapy. And well, the response is what you measure after the treatment is given, and this was the percent of the response variable was the percent of dead tissue. Now there were some other things in there that we could have talked about. As far as the other things were, neither patients nor doctors evaluating knew which one had been applied. So that means that is what's called a double-blind experiment. I don't know that I received the treatment, and the doctor doesn't know which one was given. They are just in there to evaluate it. The dressing was changed by a nurse. The other thing, a single blind would be just if the individual, like I did not know, did I receive a cholesterol pill or did I get a sugar pill? And as far as some type of treatment for cholesterol, if I, as the individual, don't know which treatment I got, that's single blind. And lastly, if I think that I got the treatment and I react differently, that is called the placebo effect. So, for example, if we were doing this study on caffeine, and I either got a caffeine or I won't say a sugar pill, but a pill of no reaction, just a blank treatment, but yet I feel on edge like I got caffeine, then that would be like the placebo effect and things like that. So again, very vocabulary laden chapter. Okay, all right. So in the number 7 through 20, and I think I only assigned 7 through 20. So this is what we have to do for all of these. So these are actually somewhat lengthy problems because of what was in the questions that we have to ask. So the first thing is, you are going to try to determine, is it an observational study or is it an experiment? So question A will be the same on every single one of them. Is it an observational study or is it an experiment? So that stays the same. Now, if the question was an observational study, then I'm going to answer questions B through E. Okay? If it was an experiment, then I will have to answer those questions B through H to do this exercise. So, off to the very first one. Let's see here. Do we have anything interested? Again, the parameter of interest. A lot of this stuff now is stuff that we have talked about. We'll talk about the randomized blocked or matched design. So we'll talk about the design when we get to an experiment. Okay. 130 patients with eligible lacerations were randomly assigned to have the wound closed with either super glue or with traditional sutures. When evaluated at the end of the study, the two treatments worked equally well with regarding to scarring. The adhesive one was less painful and worked faster. Okay, so again, we have to decide in question A, was this an experiment or was it an observational study? Okay, and again, because we have this right here, they are randomly assigned to that. That is going to make this going to be an experiment. So in the second part of this, we have to decide what we did. Okay, so now we're after the factors in the experiment. So again, this is the factor. This is what we are changing. The factor is what we are changing, and the number of levels for each. Okay, so that's the important part about 2. So the factor, there is one factor involved here. Sir, I'm getting ahead of myself. Again, I did this in my notes too. B is the subject studied. All right, so actually I'm after my subject first. Okay, so those are the individuals receiving the treatment. Okay, are my subjects, which would be 100 men with lacerations. Excuse me, not 100, 130. And it's not 130 men. I know something wasn't feeling right. There's 130 patients with lacerations. Okay. Part C. Now we're after the factor and the number of levels. So the factor is what we're going to change. In this case, it's the laceration treatment. It is going to occur at 2 levels. Super glue or stitches. Gonna run out of space here. Probably should have moved that over. So let's move this over. Okay. D. D is how many total treatments were there then? There's a number of treatments, so that depends upon my factors and my levels. So again, if we're highlighting the next thing is the number of treatments, and that is going to be 2 treatments. Okay, E. The response variable. So again, what am I measuring in the end? If we highlight the things that we need, the response variable, what is measured at the end? So what did we measure in the end? We measured their scarring, pain, and speed. F. What type? The design. Was this completely randomized, blocked, or matched? Okay, so there we go. Let's highlight this. Actually, let's highlight a different color. We'll do that one. Randomized, blocked, and matched. So now let's talk about what each of those are. Randomized is just when I have a list of individuals. I'm going to randomly assign each one to a particular treatment, and away we go. Okay. In a randomized block design, I may think, well, maybe this is different because of gender, male versus female. Maybe they react differently to the pain or to the speed of the process. So I might block my individuals by male and female, and then assign randomly from those blocks. Or maybe the age of the skin is going to be causing some type of difference in that. I would block them by age, or severity of injury, or other ways that I could block them. Match pairs design would be, I would take two individuals as like as possible, male, age, skin condition, etc., like all those things, and then give one treatment and one the other. So hopefully the only difference between the two individuals is the treatment. But that's a match pairs design, excuse me. And so that is how we had to pick between those two. Anyway, we're rolling on F, so this was going to be completely randomized. I should select a pencil. So there's randomized. There is the method of design. So G is going to be whether you are blinded or not to this. Okay. Now it doesn't say anything about the blindness. It doesn't say, but I'm going to guess you're going to know whether you got super glue or stitches. So this was not blinded. Actually, we'll put not specified. I'm going to guess it wasn't, but we don't know that. And lastly, it's going to be H, the nature and scope of the conclusion. Equal in regards to scarring. However, it showed super glue was less painful and faster. Okay, question 9, and again, we're going to answer those same, well, either 4 questions, 5 questions, or 8 questions, depending on what we have here. Okay, so we're going to roll on to number 9. In a test of roughly 200 men and women who had moderately high blood pressure, averaging the following, they did worse on tests of memory and reaction time than those with normal blood pressure. So, again, question A, was that an observational study or an experiment? Now, they said they did tests of memory and reaction time, but I'm just giving everyone the same thing and observing how they scored. The only difference is whether they had high blood pressure or not. So this actually turns into an observational study. Okay, I did not actually impose a treatment. So that is why, that's how we tell the difference between the two. We did not specifically assign them a treatment. We gave everyone a test of memory. Okay, now the vocabulary there, if I scroll back up and look, so we have to talk about whether it is retrospective or prospective. So those are the 2 vocabulary words we need there. Retro means they look back in the past. We've collected this information already. We're just looking at that information that was already collected. A prospective study would mean that I am going to select individuals to follow over time and see if they develop something. That would be a prospective. Okay. How they were selected, parameter of interest is going to be the next one. Okay, what do I want to know? And then the nature and scope of the conclusion. And typically we get a canned answer of, because there's no random assignment and no treatment groups, no conclusion can be made, but we'll see what happens here. So B, if I remember right, it is a prospective or retrospective study. And this is, again, this one's a little hard because it's not like I collected it and looked at old data. But because I didn't look at old data, we will just call this a prospective study. That one's a little inconclusive, but I'm going to go with prospective. In part C, I'm supposed to talk about I've already forgotten, the subject studied and how they were selected. So we selected 200 men and women. Selection method unknown. D is going to be, what is my response variable? What did I measure in the end, right? D, the parameter of interest. The parameter of interest was their memory and reaction time. And E was my conclusion. And again, since there was no random assignment, / / no control group. Again, we haven't talked about what a control group is. A control group is going to be the group that would receive the placebo. They would be the group that received no treatment. They're my baseline group that I can compare to. No conclusion can be made. All right, we actually only have 2 left, and we're going to call it a day. After menopause, some women take supplemental estrogen. There is some concern that if women also drink alcohol, their estrogen levels will rise too high. 12 volunteers who were receiving supplemental estrogen were randomly divided into 2 groups, as were 12 other volunteers with not on estrogen. In each case, one group drank an alcoholic beverage, the other group drank a non-alcoholic beverage. An hour later, everyone's estrogen level was checked. Only those on supplemental estrogen who drank alcohol showed a marked increase. So, question A, was this a observational study or was it an experiment? This was an experiment. Because we imposed a treatment. So moving on to part B, my subjects in this particular experiment are 24 women, 12 of which on estrogen, and 12 not. So in part C is going to be, it looks like the level, the treatment, the factor. The factor was the alcohol. It happened on 2 levels. They either got alcohol or they did not. So now this one varies a little bit differently because there's actually going to be 4 treatments. Because we had those that were on estrogen, and then we had alcohol or not, and then those on no estrogen, alcohol or not. What did I measure in the end? We measured the estrogen level. So, as far as designed, this one is the blocked design because we had we grouped women that had estrogen and grouped women that didn't have estrogen together, and then they were randomly assigned from those groups, okay? I'm gonna guess this is not blinded. I'm not a drinker. I don't have a whole lot of experience with non-alcoholic versus alcoholic drinks, but you're probably going to know which one you got. So we're going to say not blinded. And H, supplemental estrogen plus alcohol equals higher estrogen. In May 2004, May 4th of 2000, an issue of Science News reported the contrary popular belief: depressed individuals cry no more often in response to sad situations than non-depressed individuals. Researchers studied 23 men and 48 women who with major depression and 9 men and 24 women with no depression. They showed the subjects a sad film about a boy whose father had died, noting that whether or not the subjects cried, women cried more often than men, but there were no significant differences between the depressed and non-depressed individuals. Okay, so this again becomes because I did not impose, I gave everyone the sad movie, this becomes an observational study. I did not randomly assign them to be depressed or not, so this is an observational study. So with that, we have to decide, is it a retrospective study or a prospective study? And again, when you come across a retro, it's going to be looking at records that have been collected in the past. This one we're also going to consider a prospective study because we're doing it right now. Okay? So in part C, who were my individuals chosen? We had 71 depressed people and 33 not depressed people. Now, I did not say how depressed was depressed self-diagnosed or actual diagnosed. Those things were not clear, but we'll roll with that. So D is the parameter of interest. What do I want to know from these depressed people? Do they cry when shown a sad movie? And E, what conclusion can we make? And again, this is my pat answer typically for any observational study. There was no random assignment. There was no control group. No conclusion can be made. Okay. Actually, that wraps up this week, so there we go.